Hey, welcome to Sober City. My name is Seth, and I am an alcoholic. Thanks again for joining me on this week's episode. Excited for you to meet my friend, Dr. Koupal. Dr. Koupal is actually my psychologist for a few years now, so she's been on this adventure with me for a while. I was excited to get her on because she's probably one of the smartest people I know and has great insight into the psychology of addiction and just everything around how the brain works. She also has a pretty good perspective on what it looks like to live with an addict or an alcoholic. Man, she's an awesome person, and I'm pretty excited that I was able to grab her for an hour and share a little bit about how much she knows. This is a lot of good information here, so hope you enjoy it as much as I enjoyed talking about it. Kind of geeked out for a little bit, but I think there's a lot of good stuff here. So thanks again for listening. I appreciate you all. Hope you have a wonderful weekend. And yeah, thanks again. So with all that said, life is beautiful. Sobriety is worth it. Thank God for today. This is Sober City. Well, Dr. Koupal, welcome to Sober City.
Awesome. Thanks for having me today.
Thanks for joining me. Pleasure to have you. Pretty excited that you're here. So typically I ask guests how long they've been sober, but you're a normie.
I am.
So congratulations.
Oh,
on that.
thank you.
So that's good. And so tell me a little bit about yourself. You are a psychologist.
So my official role or degree is Doctor of Family Practice that I got from SDSU. And then I'm also a psychiatric mental health nurse practitioner. And then I'm also a qualified mental health professional for the state of South Dakota.
Jeez.
Yeah. 14 and a half years of fun with SDSU.
Yeah. Smart cookie. Good for you. And you are important to me because you've helped me a lot the last few years. You've been on this journey of mine.
I have.
And I think I should have looked, but I don't remember the first time I came and saw you. It would have been maybe, I would guess February of 22, maybe.
Correct.
Yeah. So over 3 years.
Yeah.
And I came to see you. I was struggling with depression. If you remember that.
I do.
Struggling with
Depression, some anxiety.
Yep, a little substance abuse.
Correct.
Yep, and I think at that point, though, alcohol wasn't my problem, right?
It wasn't your primary problem. It was part of it, but not the primary.
Right. At that time, I was really trying to avoid nailing that one down. You know what I mean? I was trying to blame everything else, but when I saw you, I would come off of pretty bad Valium detox, which is miserable. And so, yeah, I was sitting in your office and just telling you, man, I am just depressed, right? And anxious and fearful. And it's been a fun few years.
Yes. At least you stay in the office now.
Yeah.
Your first visit when you got up and took a phone call in the middle of your session.
I did. Yeah. Well, that was an important phone call. That's what we call escapism. I was uncomfortable. And so I said, I got to take this phone call, and left you alone in there with my wife, who.
Yes. I got to know her very well that day.
In that moment, she was probably, she was like, what the heck is wrong with my husband? It's so crazy. But so, yeah, that's kind of why I was excited to have you, because you're very knowledgeable, very educated, and kind of would like to get to your perspective from kind of a healthcare professional as far as what addiction might look like and what living with an addict or alcoholic looks like, brain chemistry, all that fun stuff. I would say if I could pick which to discuss first, I would be curious, what would you say to someone who is living with an alcoholic or an addict?
Definitely say that there's no quick fix. It is a process for sure, with a lot of different ancillary people and teams that work together on this to treat not only just the patient, but also the family.
Absolutely. Yeah.
Mhm.
It's contagious
Mhm.
and infectious and toxic. And people like to think I'm not the one with the problem, but you
Mhm.
live with that kind of insanity for so long. Eventually, your mindset and perspective gets skewed. But yeah, it takes a process. It's a process for
Mhm.
sure. And if someone were wanting their significant other, family member to stop, what would you tell them?
I think the first thing is making sure that you understand that you can still love that individual and that you are not to blame for the situation, and understanding that they may need help, when to ask for that outside help, and to maintain your boundaries along the way.
No, that's huge for sure.
Mhm.
And especially that first part that you said was it's not your fault. You're not responsible.
Mhm.
One of the things that we like to do is deflect.
Oh, absolutely.
Yeah. And say, well, if you would do this, I wouldn't have a problem, or the
Mhm.
problem is beyond my control. If these other
Mhm.
elements would change, then I could change or do better. And that's just the way to take the focus off them. So don't buy that lie. If somebody says, I wouldn't drink so much if you did this, or if you weren't so naggy, whatever it was, whatever it is,
Mhm.
if I made more money, all these outside factors that are beyond their control.
Sure.
Because if it is within their control, then and they're not doing something about it, then they don't like that. We don't like that.
Oh, especially. Yeah, if you're truly dependent on alcohol, you're gonna drink no matter what. You'll
That's it.
figure out any excuse that you can find.
Any excuse, yeah.
Mhm.
Good, bad, or indifferent.
Mhm.
Yeah. And then boundaries.
Mhm.
What would you say boundaries look like?
So I think one of the first things for people is, not to take it personally. They'll say that they're not going to drink again. A short time later, they'll pick up the bottle. And it's not because of you. It's not because of the situation that they chose to do it. It's because they're mired in the addiction itself. And your brain chemistry will change over time with alcohol use, acute as well as chronic. So again, you don't want to take it personally, but you also need to know when you need to step back as well. That is when we start looking for outside sources to get help, to not allow disappointments from previous as you start this journey with your loved one to become something that impacts your ability to see recovery. And, circumstances change all the time when it comes to addiction.
Right. Yeah, and taking a step back, right? Taking a
Hmm.
break, put yourself first when you need
Absolutely.
to. Yeah, if you're exhausted, you're not going to be of help to anyone. And I think too that's one of the tactics that alcoholics and addicts like to use. They like to wear people down.
100%.
When you're emotionally drained and physically drained, I know a form of abuse is like sleep deprivation.
Correct.
Ensuring that it's a form of control. Yeah, and control is a big it's an important part of addiction and alcoholism, because as long as you feel like you have some control, then you have that illusion of manageability. And
Hmm.
that's why the first step to really getting sober is the admission that your life is unmanageable. Not
Very
just
true.
that you have a problem, but also that your life's unmanageable. Because a lot of times we know we have a problem right away. We know we're different. But as long as we can manage, we don't
Hmm.
really have a reason to stop. So yeah, that's good. And if someone were to try to draw a line in the sand, well, I think that's one thing that's tough is like enforcing boundaries.
Hmm.
Any thoughts on that? What that would look like?
Oh, absolutely. A lot of the times when you're dealing with alcoholism or drug use of any kind, people usually will downplay the extent of the problem because they don't want somebody to try and get them help, especially if they're not ready to get the help. So, the big thing I tell people is you have to let the crisis happen. The rock bottom has to occur. If you want to help your loved one, you're going to let that situation happen and do nothing in the moment, and then compile resources and support as the incident occurs and ends in phases. So, the big thing I tell people is you don't want to rescue somebody from that situation. You want the situation to play out, because that is that key to humanizing the individual struggling with addiction, but also gives them the opportunity to see both sides of the coin when it comes to trying to help them versus where they could continue to be.
Yeah,
So,
absolutely, 100%. Yeah, well said. Not rescuing them seems counterintuitive, right?
oh,
Trying
absolutely.
to keep this thing from getting bad, trying to
Exactly.
keep this from getting worse. And yeah, don't do that. If you let them fall on their face, That's probably one of the better things for them to experience. As long as they feel like they have a safety net, as long as they feel like there's no consequences, it'll just perpetuate and continue to escalate. And really, you're delaying the inevitable, right?
Correct. Yeah. You want to be able to understand that they need that outside help after that crisis occurs. And looking up your resources, knowing your stages of addiction, knowing what it does to them over time with sobriety as well as intoxication, and futuristically planning. We're human. Things can happen, relapses happen, sobriety happens, triumphs happen, opportunities happen.
Right.
So at any point in time, it goes through phases and stages. So it's always good to be aware and not accept maladaptive or negative behaviors along the way, staying consistent with your loved one.
Absolutely. Do not accept poor behavior. That's one thing that's frustrating is alcoholics skew what's acceptable, and we kind of allow them to get away with things that we wouldn't allow a normal person to. And that's part of the manipulation is, well, I have this sickness, I have this disease, so drinking in the car is okay for me. No, that's not okay for anybody. And you said something else that I think is important, which is educating, right? Educating yourself, knowing your resources, and then also understanding what this looks like, which brings me to one of the other topics that we were hoping to talk, which is the chemistry of the brain.
Oh, absolutely.
If that's all right. It's just a segue into that because you said, long-term drinking, even if it's a minute amount, still changes the chemistry of the brain.
100%. And we look at guidelines for that too. So women, if you do more than 4 drinks in 2 hours in one sitting, or more than 8 drinks a week, or a guy, more than 5 drinks in 2 hours in a setting, or 15 drinks a week, it's considered a form of alcoholism, predisposing to binge drinking, things like that. And a lot of people think, I went out and every weekend I go to a social event and we have a bunch of beers and we're good, and that's the only day I drink. And so that's not really a problem. Well, the reality is a lot of the times it's how that acute intoxication turns into chronic intoxication. So the brain, women and men are both different, but a lot of the times we see with scans, MRIs, CTs, over time, men seem to have more of the white matter, gray matter change. And they believe that's hormone derived, so testosterone, things of that nature. And then women, of course, have the vulnerability towards a quicker intoxication, a quicker atrophy as well. But there's also research indicating that both of them will phase out together when it comes to acute versus chronic alcoholism. And age is a big factor. The older you get, the chronicity obviously is going to do more damage. You're pickling your brain. That's what's happening. And eventually, that comes to call. So that's kind of the difference between the two of them. Behavior changes are pretty akin. We talked about a lot of the manipulation tactics, the downplaying, the avoiding is very, very common because it's exciting to drink alcohol when you want to pursue it, especially if it's not something that you should be doing or you shouldn't be doing. And so your dopamine, your natural high you create, goes through the roof. Brain loves it. The man loves it. The woman loves it. Both brains do. And so when we're looking at the brain and how it goes over time, alcohol basically will infiltrate and will give so much happy you just can't keep up, much like many other drugs and impactors that are going to give you that dopamine vibe. So over time, the brain continues to get disappointed. And we'll see people, especially in my world of psychiatry, where we deal with irritability, sleep issues, anxiety, hyperactivity, and inability to focus. That sounds like a lot of different things, right? It could look like attention and focus. It could look like panic attacks or anxiety. It could look like this person has chronic sleep issues. But if you do your due diligence, you will definitely find, if there's something to be found, that alcohol is a major part of all of those symptoms.
Right. And if we can deflect from the alcohol and say we're bipolar or something to that effect, dissociative personality disorder, number of things. Yeah, I prefer be it those because that also plays into the idea that, if I'm bipolar, I can't help being bipolar. That's a mental illness that I have no control over. Alcoholism. And you had said earlier, whatever number of drinks was considered alcoholism. When actually is the term alcohol abuse. Right. They wouldn't call that alcohol, because alcoholism is different than
like an early form. It's a predisposer. So
right.
you would have that would be opening the doors for opportunity. And if you think of somebody who is genetically based, so somebody who has a predisposition to alcoholism, because alcoholism does carry a genetic component, then you're setting yourself up for a vulnerability or susceptibility to alcoholism. When you're first working with a patient, before you get to the depth and brevity of it, we can't ascertain or know for certain that this doesn't carry an age-old background to it. So you have to be diligent of that. And I am also medication-assisted trained for addiction. So when you're thinking about addiction and somebody comes in to talk with you, you're thinking of several different differentials or reasons why that could be, but you have to consider the inherent risk the moment it's discovered that this could be a projection of increased use or increased drinking over time. It's not something to be taken lightly. It's definitely a multifaceted approach to treat addiction. So the sooner you're aware, the sooner that you are cognizant and looking at the global picture when it comes to a patient, the better chance for resources and outcomes.
Right. And I think the reason why I was wanting to clarify like the
Mhm.
difference between alcohol abuse disorder and
Mhm.
alcoholism is because I know people who suffer from alcoholism and don't drink at all.
Correct.
Right. And so I think that's one other thing that I want to point out is some people would think that, oh, if they just stopped drinking, life would be so much better. When in reality, they're a lot of times disappointed because the person is still selfish and self-seeking and fearful and angry and sad, whatever. And on top of that, then the person that isn't drinking is then also saying, well, aren't you happy now? I'm not drinking. And so then it's like, no, this isn't better at all.
Right. And it comes under a big umbrella of alcohol use disorder in general. So we quantify it with the DSM-5, which is kind of our measure of metrics, alcohol use disorder and what that entails. And there's a lot of, like we say, differentials or different causations behind how you come to the conclusion of alcohol use disorder. So when you're talking about dependence or abuse, we look at complicated versus uncomplicated. What measures complicated versus uncomplicated, right?
Yeah.
A lot of the times we look at that as a basis of what is their vulnerability, what is their propensity, what is their risk towards becoming an alcoholic. So if we frame it from the mindset as a provider of you're looking at the projective scenario, how far could this go? How deep does this go? And how complicated can this individual get?
I see.
You're preemptively trying to get into the mindset of you have to have the ability to anticipate whatever may happen as you go further and further down somebody's discovery.
Right. Okay. And I think the reason, I guess, and just for my own education, does the DSM-5 actually have like alcoholism? Does it define it as alcoholism?
Alcohol use disorder.
Right. That's what I was like.
Mhm.
Alcoholism. And that's with alcoholism, I generally kind of just have the attitude that nobody can really diagnose it except for the person that has it a little bit. Alcohol use disorder obviously is in the DSM-5 and whatever, but I think there's components, and I'm not saying you could say it, of course, but if they don't, then it's not really as effective. When you were talking earlier about like dopamine release, right? I like dopamine.
Most of us do.
Most of us do. I think that was probably my problem was if I can find a cheap, easy way to get a truckload of it.
Oh, yeah.
That's what I like. But I think my brain is a little different than yours or like my wife's, because when I have a drink of alcohol, my brain kind of goes off, right? Versus a normal person doesn't do the same.
Correct. Yeah. So we know that the brain is huge as a motivator, right? It helps guide our behaviors, how we interact with other people, what's pleasurable, what's noxious, what's good, what's bad, and everything in between. So when you're dealing with alcohol use disorder or dealing with alcoholism in general, people will change in very emotional states, whether you are somebody who has a propensity towards alcohol or has experience, or somebody, as you described earlier, as a normie who doesn't have a history of alcohol use or doesn't struggle with that background. So we talk about individuals who do struggle, especially when you said you need that high, you need that that kick of dopamine, right? There's a lot of things that come with it. So being impulsive, like I said, compulsive, your judgment is not as good, and your impaired decision making is paramount with alcohol use. And people who have that drive to chase that dopamine, those effects and those symptoms are volumes above somebody who has a normative brain who's not impacted by alcohol use.
Right. And that kind of plays into when somebody says, why do they drink? Right. Don't they love us, or don't they realize what's at risk? Really, your priorities are so skewed, and you kind of have control to a degree when it comes to not having that first one. But man, once you have that first one, your brain, I can tell you, works against you.
Oh, yeah.
I would never risk going to a liquor store at 2 PM and buying a bottle of Fireball or something and getting caught. But if I had just got done golfing and had 3 beers, makes total sense to me.
Oh, yeah, associated with an activity. And the brain basically gets to the point where it's motivated to drink.
Yeah. And then your brain is like, this is okay, as long as you don't get caught. And here's how you don't get caught. But then you finish that bottle and your brain's still like, we should probably get some more.
Oh, yeah. By that time, you're really tripping into the world of glutamate. And glutamate is like our gas pedal in our brain. It's that driving force to produce more dopamine. And it's usually channeled by what we call norepinephrine, which is that fight or flight, want to crawl out of your skin, anxiety response, and that urge to complete the act. So glutamate is hugely fueled by those two transmitters, which pushes the drive even more for being excited about having that bottle of Fireball or having those drinks after golf. And so individuals who are more sensitive to that or more prone to that, I mean, their dopamine goes haywire. It's all over the place.
Yeah. And it's not just alcohol, obviously.
Nope.
Same would be for like opioids. And do you get dopamine from benzos, or is that just more of like you don't really get the same euphoria from benzos, which are
Not
like Valium or
typically.
Xanax?
Yeah, it's more GABA is the driving force for that, which is a butyric acid, basically, or amino acid base. And what it's designed to do is it's designed to calm the mind. It's like your brake pedal to your glutamate, which is your gas pedal. So the ups and the downs in your brain. So benzos are going to look towards that GABA to try and calm the system down when you're feeling the need to rise and become excitable.
Yeah, and I think that was the thing that I liked about benzos was for the first time, I was like, I feel great.
Oh, yeah.
Like fearless.
Oh, yeah. That's that binge intoxication stage.
Yeah.
There's 3 stages to it. It's binge intoxication, withdrawal, affect, and the negative and the anger behind it, and then the preoccupation or anticipation, waiting for the next opportunity. And that's what we gauge a lot of it in when we work with treatment too, is what phase are you in? Where are you at? Do you experience all 3 phases? And a lot of that is done through some of the metrics we use, like CAGE questionnaires or different types of questionnaires geared towards alcohol use. And do you see it as a problem? Do people around you see it as a problem?
Right. Yeah, that's interesting. But that's something I noticed. With benzos, I had less of a propensity to take more.
Correct.
There wasn't like, 1 feels great, I wonder what 3 feels like, right? So,
You're not driven by dopamine.
Yeah.
A lot of the times with a benzo. Where alcohol, you can have dopamine, GABA, opioid receptors, and derivatives of that.
Right. Yeah, with opioids, it was very much, if I got my hands on some, let's say 10, and I'm like, this will last me 10 days, 1 a day. Then I'm on day 2, and I'm like, how do I have 3 left? It was insane. It was frustrating. It adds to the fear then, because what am I going to do when I'm out? But when you talk about alcohol, though, and that gas pedal, just go, go, go. How much does like socioeconomics? I know we talked about genetics.
Oh, yeah.
So you can be genetically disposed.
Oh, yeah.
Some families inherit wealth. I think I inherited alcoholism. But then you talk about if you're living in poverty.
Correct.
Of that propensity, how does that environment play into alcoholism or
It's
addiction.
quite cyclic. I mean, if you think about it in the socioeconomic status of things, people who are in disparaging situations are going to find ways to numb out, forget, avoid. So you can't pay your rent, you can't pay your bills, you can't afford groceries. What are you going to do? You're going to avoid.
Escape.
Yeah, escape.
Avoidant
And
behavior.
yeah, absolutely. So lower socioeconomic classes with financial burdens and limited resources for treatment, which is another big thing, very adversely impact how things go. If you think like inner city Chicago versus here where we live, public transit here is not a thing. Public transit in larger urban areas is. But at the same time, these individuals are not working banker's hours. They are working shift work. They are working opportunistic positions to try and get income for their families as fast as possible. Day labor positions, weekly paid positions. And so that's one of the problems we see with socioeconomic status, because even though, they have the resources, you'll hear about like clinics like that have anecdotal medications, and you still have to have a means to get there. You still have to have the time to get there. A lot of these areas, it's not a 24-hour thing. And so here in Rapid, we don't have a lot of public transit, and we have a lot greater distances in between. And we have a lot of different service industry positions around here where certain hours is what they can work. And if they can't make it work, they can't get there.
Right. And then the idea of just numbing out, like mental vacation, and it really can become a perpetual treadmill.
Yeah.
Poverty. My guest last week, David, talked about how his drinking put him in the hospital, and then his work required him to go to treatment. Neither the hospital or the treatment were covered by his insurance. He ended up having to sell his home, and he was a pilot. It really doesn't take much. Everybody's really one medical emergency away from living in poverty.
You made a very good point there, too. I mean, we talk about lower socioeconomic status, but alcohol truly, is as impactful as it is towards lower socioeconomic status. Anybody at any various level of wealth can be impacted by alcohol.
Well, and that's it. If you have money, you have a better ability of having that appearance of manageability. In addition, if you have resources and your position holds what society deems more valuable, then you have the support of your employer or other people to try to get you the treatment and help you need. Whereas if your job or profession is more disposable or replaceable, your alcoholism has a much better chance of putting you in a spot to be criticized or judged. And that's the reality of it. No, if you drive a nice car, have a nice home, but you can't even walk at the end of the day, are you really an alcoholic? You know what I mean? Obviously you are, but if you oversleep and miss your job, right, because of your drinking, then people say, oh, and I think society in general likes the idea of like this, it's comfortable to think that alcoholism is confined to poor choices.
Correct.
Or, personal responsibility, when in reality, that's not true. But you see somebody drunk downtown, you say, oh, well, they're like that because of their alcoholism or their drinking. If they just stop drinking, then they can get better. But it's a lot more complicated than that. And I know people who have very well-paying jobs and very well put together that have had a much worse drinking problem than I did, because my drinking was relatively manageable.
Correct.
I was able to keep appearances for a long time.
You did. You actually did quite well.
Yeah.
And that's the thing, too, that we think about when it comes to working with alcohol and working with addiction and recovery is, like you said, it knows no bounds. You can be functional, you can be dysfunctional. But one thing that at the end of the day can't be avoided, can't be changed, can't be manipulated is that your brain over time loses that neuroplastic. It loses the ability to rebound. And eventually there's no coming back from that. So providing resources and coming to individuals such as myself in therapy and psychology and addiction trained centers such as, Project Recovery, places like that to receive services with the understanding of being realistic towards helping and supporting other people is paramount. It's just education is invaluable. If we have those resources out there, if we're comfortable and open about talking about the condition, that really helps a lot of people come in. I see a lot of people from different backgrounds across different walks of life. I've lived a life mired by addiction with 2 parents. And the reality is that if they feel supported, if they feel like they can keep coming back, I encourage as a provider, especially the non-judgment stance of things and knowing that people do have histories, they have backgrounds, they're human beings, and that we have, a responsibility to ensure that we give them the best care that we can, regardless of whatever we may think with their life choices. So their life is like that because, well, they're an alcoholic or they did this to themselves or any of that nature. People are more complex than that. There's a lot more history than just, it's got to be alcohol.
Right. But it's easier because it
Mhm.
fits in a box. We like
Absolutely.
things to be in boxes
Yes,
and
we do.
confined, and that's not going to affect me. My
Mhm.
kids won't be alcoholics because
Right.
I raised them in church and I've done very well financially. I don't drink in the home. Like all these things we think,
Mhm.
as long as I play by these rules, then the world will abide. Well, there's a quote that I really like that says, we must rid ourselves of the illusion that we can wrest satisfaction from the world when we're managing well. It doesn't matter how well you're doing or how well you're managing. There's no guarantee that you're going to be satisfied. You're going to have issues. You're going to have problems. And that's something I tell guys that get sober or trying to get
Mhm.
sober because, they do well for a while and then something happens and they're like, what the heck, man, I'm trying to get sober. And or this person did this to me. And it's
Right.
like, that stuff's going to happen. Life doesn't care that you're trying to get sober. It's still going
Mhm.
to chuck a dodgeball at your face.
100%. That's
Yeah.
living.
And so it's just but you got to have the tools
Mhm.
to be able to handle it. And you had mentioned neuroplasticity is really an incredible thing.
Yes, it is.
And
Yeah.
it's like you said, you could lose it, right?
Mhm.
With alcohol abuse.
Mhm.
But in sobriety,
Mhm.
neuroplasticity is wonderful.
Correct. Regeneration or reforming, especially giving some of that brain strength and gasoline back by balancing your transmitters and creating therapeutic environments and healing from the trauma of the substance itself really will bolster your resiliency. Much like your resiliency with your sobriety, your brain itself experiences a resiliency and a recovery.
Amazing thing. Your brain heals for one, but then it also through a manner of living, however that looks, as long as it's positive and different than what you're used to,
Mhm.
your brain creates new pathways, which is awesome. And I think that's what's kind of encouraging and life-saving is there's not a drug for it.
Right.
It's through lifestyles, through principles, it's through discipline. And that's why community is important because if you're going to create a new pathway in your brain, want to
Mhm.
create a new pathway in life, you surround yourself with positivity and gratitude, these positive thoughts, think positive, right? One of the reasons why earlier I was kind of being kind of ardent on the difference between alcohol abuse disorder and
Mhm.
alcoholism is because really when it comes to a solution to alcoholism, spirituality is
Yeah.
huge.
It's a conduit for sure. And very much a part of a lot of meetings. We've talked about that and sponsors with the Christian benefit or the religious component of hope, and a future and the ability to see forward.
Right. And that's why if somebody's struggling with alcohol, it's difficult to, in like a scientific medical environment, spirituality is not going to be real. You know what I mean? I mean, you're a spiritual person, but when you're talking about the DSM-5, right?
Definitely do not consider that. Environmental factors we look at obviously as a form of support, right? Anywhere we can garner support through whatever supportive resource you have, family, friends, influencers, moderators that are going to help you on your journey to sobriety, are going to sprinkle in their own flavor. Some people are going to bring in a religious stance. Some people are going to bring a cultural stance. Some people are going to bring a holistic stance. You're talking about oils and chakras and things like that. And then, of course, in our realm, in addition to therapy, we also utilize, cognitive behavioral therapy, mindfulness therapy. And then, of course, there are a couple of medications that can be utilized. But as I tell people, in the world of medications, they're merely tools, right? Medications are not cure-alls. They're not going to fix the problem. But what they can do is provide you with mental clarity to see all of those environmental options and utilize therapeutic means to heal your brain.
That's right. They are not intended to be a lifelong.
No.
Your goal is to not take any, I think, and you can get there. I mean, I don't even know. I was taking lithium for a while.
You were.
And that's a pretty heavy.
I remember you were sitting in the parking lot one time when you called me and you were in Target and you had taken off. You'd driven for a while, dissociated, came back into town, found yourself in the parking lot asking for buspirone, asking for your lithium.
Right.
You were really struggling at that point.
I forgot about that one, actually. I forgot about the Target parking lot one. I don't even remember when that was, but I do remember it was in like November.
Yeah.
I think when I called you, and I was severely suicidal.
Oh, yeah.
And that was for 3 months into sobriety. I think the most suicidal I've ever been. And I felt like that was, but still, that worked, I think, for a period. But now, by the grace of God, I don't really need any of those buspirone or lithium or any of that stuff. AA obviously has spirituality be a big part of their program, and I always stress this isn't an AA podcast. I don't say that AA is the only way to get sober, but I like to point out or bring up as an example when it comes to spirituality being important to sobriety, because AA is kind of a derivative of the Oxford group, which was a Christian group. AA is an affiliate with any sect or denomination or religion. But Oxford Group was Christian. Within Oxford Group, there was a gentleman by the name of Roland Hazard, which is an awesome name. He was a student of Carl Jung.
Yes.
And Roland Hazard found spirituality because Carl Jung had said, this is what you need to do if you want to get sober. But Carl Jung kind of said, hey, let's keep this on the down low.
Right.
Because when Roland Hazard started saying, hey guys, this is how you fix it, which eventually got to Bill W. and Dr. Bob, who founded AA. But Carl Jung was very concerned. He thought he was going to get ostracized from the psychology field. And in reality, he's kind of the grandfather of sobriety as far as somebody who really kind of dialed in that I don't think there's any other thing to fix us outside of this spiritual component. And so that's kind of, I like to mention that because you can speak to my attitude towards spirituality when I first met you.
Non-existent.
Just
non-existent. Like, it was very factual. It was very clinical. It was very much step to step. This is what I do. I check the box. I take the meds. I follow through with the transmission and I see results. But I noticed over time that definitely started to wane when you got additional stressors put in front of you between your boys and your mom, your dad, your wife. I mean, the people that were important to you, and just how impactful it was becoming. It was getting harder and harder, and you definitely struggled with that. It was kind of letting go of the old to embrace the new. So the first time you came to my office and you told me that you were looking at the principles associated with AA, I definitely was surprised.
right
In a good way.
Well, yeah. And I don't remember when it was, but I told you something about praying.
You were praying, yeah. And I was like, you pray?
Yeah. I think you were more shocked. You're like, who is this guy?
Yeah.
Because, I was very anti-religion, I wasn't just an atheist, I was an anti-theist, as opposed to the idea of God, because I figured society was being held back by religion, this antiquated system of beliefs where we have science, we have logic. I was very into Stoicism, Marcus Aurelius and Seneca and early Greek philosophy. And that was kind of and I really like to argue politics and religion. That
Absolutely.
was something that was important to me, was telling people how they're wrong and trying to strip them of their foundational beliefs, which is really pretty selfish.
Well, you talked about a form of control.
It's
at
control.
that point, it was control.
And it's ego, because nothing's more important than to be right.
Correct.
And that's exhausting. And that's really a trigger for me. When I feel like I'm right, they're wrong, and they will not tell me I'm right. For some reason, it was really important to me that people told me I was right. And what that led to eventually was ending up on my mom's couch.
Yeah.
Right. And my wife kicking me out. And somebody once said to me when I was emphatic and I know I've spent a lot of time reading and studying, and I loved arguing and pointing out flaws in logic or whatever. And somebody finally just said to me, Seth, why would anyone listen to you? You're living with your mom right now. And it was tough to hear, but I think that's right. And I think what that led to was me just saying, everybody's entitled, right? I mean,
Well, I think that was definitely a cathartic time for you too, because that was when the letter, the garage, some of your big moments of catharsis,
hopelessness.
of change.
Yeah, that's what you said initially was hope. That's a big part of spirituality and faith.
Yeah.
Yeah, the opposite of fear is faith.
That's right.
And I can tell you I was a very fearful person. And now when I know if I'm being honest and doing what I'm supposed to be doing and acknowledging that I could be wrong, I'm very likely could be wrong, and accepting people and loving people wherever they're at, whatever they believe or however they vote, whatever, it's just a lot more free. And I have faith that things will be okay.
Yeah.
But before, I lived in fear all the time because I was living according to the gospel of Seth, and I was seeing where that was leading me, and that was to self-destruction,
right,
and ultimately death. I mean, I couldn't wait to die, in a way where it's like, that's why I like sleeping a lot, you know what I mean? And that was something you mentioned, like, looks like depression or
it
whatever.
does. It can look like depression. It can look like you said, bipolar disorder. If you're impulsive, if you're reactive, if you're hyperactive, I mean, it can mask itself as mania. Of course, anxiety is a part of that. Insomnia, the sleeplessness of it. You can't shut your mind down. I've had a lot of patients tell me over the years that alcohol helps me sleep.
Right.
Alcohol is actually very disruptive for your sleep.
It's terrible for sleep,
it's
right?
Terrible.
Yes.
There's 6 phases of sleep, and alcohol will dip in and disrupt every one of them.
Yeah. You're just floating up on sugar.
Exactly.
Yeah.
And I mean, ethanol in and of itself, processing. You're a carbon-based life form. Alcohol has carbon-based nuances to it. It's just your body having to work harder to expel. So you're using more resources that you should be using to rest and to regenerate and to form long-term memories.
Right, because even though you're sleeping, your body's not resting.
100%. In certain phases, they're not.
That's it. And alcohol dependency. Well, like obviously you have alcohol dependency if you go on a bender and then you're like, you get the shakes, you get to that level, and that's pretty obvious. But if you're talking about somebody like me who didn't drink like that, I wasn't a binge drinker, I wasn't a blackout drinker, but I still had alcohol dependency because I couldn't go super long without drinking. And it wasn't because I was having withdrawals.
No, it's that chase. It's definitely that rationalization. You've associated alcohol with whatever non-realistic, euphoric presence it provides you. So you're going to go chase that. And you're going to go looking for it. Like you said, you're going to rationalize it. You're going to normalize things that are not normal. They're very abnormal or illegal in order for you to get that standard that you're looking for. Highly intelligent, highly resourceful people struggle with addiction because they're able to basically become chameleons. They can change their environment, suit their environment, and anticipate the end goal, which is satisfying that craving, that need.
And I'm definitely not super intelligent, but I am manipulative. I am a chameleon, and that was me. I'm surprised I've made it as far as I did without getting the DUI or
very resilient.
Convincing my wife. I mean, alcohol had been a point of contention for us even when we were 21. Somehow I was able to convince her just to let me drink one more time, right? And that's kind of why I like doing this podcast or just owning the sobriety thing, because there's no turning back now.
Right.
It's like, I own this thing. That's the only way to do it, and putting it out there and being vocal. And when you say when you talk about alcohol's effects on the brain, or like a period of time wanting that We always talk about this gift of desperation or the miracle where our obsession is gone. But it was more of like, and I'm not trying to science the miracle, but it's the brain learning how to function, right? There's a part of the brain healing, which is the brain's no longer thinking this is necessary, right?
With the alcohol in the midst of it or after sobriety.
The need to drink.
The need to drink. So over time, I mean, you can only produce that euphoria for so long. Your brain has juice and battery for only so much. And then eventually it becomes boring. You just don't produce what you need to produce anymore. So it becomes almost like a medication where you're taking something daily or taking something routinely, and that chemical code of alcohol imprints itself and just becomes part of the day-to-day. Like you take a blood pressure pill or you would take a diabetes pill. Your brain becomes comfortable towards the alcohol.
Yeah, it's more habit than addiction.
Absolutely.
And that's something we say is the jumping off point is when you can no longer live with it or live without it.
Correct.
Because you are drinking just to drink. You're no longer getting that euphoric feeling.
No. And that's that individual risk that then becomes the object of chronicity. Over time, it's like a disappointing birthday party. You just can't keep up with that chase because your brain has no more chase to give.
Right. And so that's where eventually the results of the consequences compounded by the idea that this stuff isn't even working anymore. I need to find something else, right? And so all those things combined could ultimately lead to somebody addressing their inability to live life without a lubricant and find healthy coping mechanisms, which, you get medication, you know what I mean, initially, but also you find a program, you find pillars or principles, whatever it looks like.
Correct.
And you adhere yourself to that. So that's good. And talking about medically assisted sobriety, one drug that I love and encourage, and I think you do as well, is Naltrexone.
Correct. Naltrexone is a wonderful way, even with the camprosate. Some people will talk about disulfiram, which is classically known as antabuse, and then Vivitrol, which is the naltrexone injection. And so people can actually get injections over spans of time as well, especially if you're concerned about, early sobriety. Is this for me? You'll notice a lot less adherence towards appointments, and there's an excuse, or I'm going to reschedule, or you see those gaps in time of treatment when it comes to medication management. Vivitrol injections allow the ability to do monthly injections with the posit that it's going to be supportive over 3 months. And that injection is naltrexone based. Oral naltrexone, which is the one we worked with you quite a bit on, simply put, as we've talked, is it makes alcohol boring. So it puts up a nice little drawbridge. I don't know if you've ever seen Monty Python and the Holy Grail.
Oh, yeah.
The guy that stands at the bridge doesn't let people pass, right? And you have to guess the right color or guess the right animal situation, right? So what naltrexone will do is as that signal to drink alcohol comes across the bridge, the drawbridge comes back up and blocks the signal from completing. So you don't get that euphoria at full bore as you would have previously. So the brain goes, okay, now what? I got 50%, so what am I going to do with the other 50%? Then with your classical coping skills and therapeutic support, that 50% left over that the med couldn't touch is where you utilize those skill sets to deviate from wanting to complete it. Get the other 50%.
Yeah. So if you're taking naltrexone and you try to drink, so like antabuse you mentioned, antabuse makes you...
You drink, you puke.
Yeah, you drink, you get very sick. Not, I don't think, the most effective because I've seen guys drink on antabuse, which is, you could die.
Oh, absolutely.
But still, that just shows that that's just not enough. Like, death does not scare us. That's why people are like, why would you risk, there could be fentanyl in that. It's like,
it's not what I'm
thinking.
It's
a win-win. I either get high or I die. And that's really the attitude that we have. But naltrexone's great because if you do drink on it, man, I don't really have the need to chug a pint of Fireball.
Yes, it's complementary to tearing down from alcohol use. So you can take it while you're still drinking because as the boredom continues to set in, you don't finish that drink. You don't finish that bottle of wine. You don't finish that glass of brandy. you basically have a couple sips for the aspect of taste and recognition, and then you're like, okay, I'm done. Like, it just doesn't seem appealing to me anymore.
It's amazing. I love it.
Mm-hmm.
And I was taking Naltrexone since 2019. That was so I had tried to I quote unquote got sober in 2014 for 5 years, but I wasn't sober at all. Any chance I got to drink, I would take it.
Yep.
But in 2019, I convinced my wife to let me drink again. And I had sold her on the idea of Naltrexone because I would take Naltrexone and I wouldn't have to even finish one beer, which was crazy. I'd leave beer on the table.
Yep.
And I loved it. I was like, oh my gosh, I'm a normal person finally. What was ultimately my demise, though, I started doing ketamine, medicinal, like medically, right? I was in a medical atmosphere for my depression. I still had that addict mindset. And so they said, okay, you can either do the nasal spray or you can get it injected, but the effect won't be as good.
Correct.
With the nasal spray.
Yes. Yep.
And so, of course, my Seth's mind is, inject it. Yep. I want the full, and every session, my depression's not better. Amp it up. And they were trying to figure out how I wasn't getting better, right? And they said, you're taking Naltrexone. If you take Naltrexone, then that dampens the effects of ketamine.
Correct.
So no question in my mind, I'm off Naltrexone, right? And man, it was a matter of 4 months, I think, when my wife kicked me out. That's how quickly being off Naltrexone, because from 2019 to 2022, so that was 3 years. I wouldn't say of healthy, but I wasn't drinking uncontrollably because I was on Naltrexone. But that's just more background for the people listening. But Naltrexone is great. One thing I also noticed with Naltrexone was like I drink way less coffee. Like I still take Naltrexone just because I noticed that I don't overeat. When I'm full, I'm full. Like all these little things that used to give me little highs now, I'm no longer interested in having 2 burritos.
No, Naltrexone works on the limbic system. So it's working on your reward consequence center of the brain, the impulse drive, your flair for the happy, basically. If that includes drugs, alcohol, pornography, chocolate, chips, books, music, whatever gives you that. Opioids, exactly. Yeah. Whatever gives you the flair for the happy. And so Naltrexone doesn't deviate or pick and choose which type of addiction. Addiction in and of itself is going to try and continue to produce dopamine in the euphoria. Naltrexone is going to stop that process, no matter what the fixation is. That's why we use it as a partial adjunctive support in a drug called Contrave. Contrave is a weight loss drug. You talked about binge eating. It's actually paired with Wellbutrin or bupropion to help with formative weight loss and binge eating. Naltrexone also has evidentiary support in fibromyalgia, which is a form of nerve pain because it works with norepinephrine. Norepinephrine, that when we talked about earlier, that fight or flight transmitter, that physical ick, want to crawl out of your skin, anxiety transmitter.
Yeah.
It fuels norepinephrine will fuel what we call nociceptors or pain receptors.
Right.
So you can get those things going. Exactly.
Yeah, right.
So it gives a better balance. So we're not flaring up our pain receptors as much. So it's had clinical adjunctiveness. There's also a low-dose naltrexone. There's an extended-release naltrexone, and there's an instant-release naltrexone. So some people for addiction will utilize like a 4.5 milligram dose of naltrexone because they just need enough to take that surge or edge off, but a full dose is too sedating or too calming of an effect on the brain. It's numbing the brain down too much from the excitement. In all areas, not just the addiction.
That's it.
So.
Yeah. But as a caveat, naltrexone is not a substitution for sobriety.
Correct.
Yeah, you just taking naltrexone, you're still going to be miserable, for one. And two, I can tell you, if I found somebody, if I ever got an opportunity to get opioids or anything, I would stop taking naltrexone for a period. So because even when I took those, I noticed I didn't get that high. And if I had no pain, I really didn't feel anything with these hydrocodone or whatever it was. And I felt like it was a waste. So I would stop taking naltrexone until I was able to ride the opioid train, and then I would get back on it. But same thing with the ketamine. And then also too, there would be periods where if I was going on a trip or something, I would stop taking naltrexone because I wanted the full effects of the alcohol. Those are the types of things where it's just, and antabuse, like we talked about too, is not an effective method of staying sober. I know lots of guys who just drank on and abuse.
They absolutely, yeah, they can. And you hear like puking rallies and things like that, nomenclature utilized when you're heavily drinking and you throw up and you keep going. Again, like you said, whether you live or die, if you're trying to achieve that end, you're not thinking
Not thinking.
about one end or the other. You're thinking in the moment. It's that impulse to satisfy in the moment. And the great thing about naltrexone is that you get, again, 50% of that activity back. Well, what a great opportunity to use the other 50% to concentrate on sobriety or your goal setting or your priorities towards maintaining, because you're not fully fixated on alcohol.
Right. And that's where you build those new pathways, where you start working on that neuroplasticity.
Absolutely.
There's a lot of times, because of the genetic disposition of alcoholism or addiction, more than likely we have trauma. We weren't given very good tools when it comes to coping with life. We adopted whatever our parents were using, which is probably not the best tools to use. And so you learn to use different tools. You find different tools. You find what works for you, gradually become positive. But it's a lot easier, like you said, to focus on those things and work on those things when you're not obsessing about getting effed up, for lack of a better.
Oh, yeah. Getting the next drink and the next opportunity.
Yeah.
And I feel like firmly, too, you have a choice, coming from two parents who struggle with alcoholism to this day. Both my mom and dad are alcoholics, that genetically, my siblings and I were all predisposed to the same genetic material, 50% mom, 50% dad. One of us chose to follow a different path. Two siblings chose to follow the path of addiction. So we're all presented with the same DNA morphology, 50% mom, 50% dad. Our genetic makeup or blueprint is what it is. But part of it is that exposure to those healthy environments, like you talked about, those resources, those tools, those materials, and seeking that support can really be so impactful. A medication didn't make a difference towards me and my siblings making the choices that we did. It was the people in our lives and the impact of what was available resource-wise to give the support that was needed.
Yeah, and I also, you, like we talked about, you don't have that brain chemistry, right? When you drink, you have an off switch, right?
Well,
Or you have, like, that's one thing we like to say is we have a broken off switch, right?
well,
Because
in
once we turn it
college,
on,
yeah, yes and no.
right?
I mean, point of fact, in college, we were always drinking quite a bit because I think it's just socially acceptable and a social lubricant. So in college, when I was in Brookings, I did have a problem with that, actually. And I knew where I was headed. And like you said, being rooted in trauma, I am a diagnosed complex PTSD patient. So there were times where you'll try out all factors and tools as a means to salve whatever beast is inside at the time. And so alcohol actually was something that I gravitated to for a while. And you mentioned opioids. I was living with 3 roommates over by the local bowling alley at the time. And I was probably 19, and we had experimented with snorting oxycodone a couple of times. And I remember right around that time, I had also gotten my first DUI. I drove under the influence of alcohol during graduation weekend in 2006. And it cost me. For the rest of my life as a professional now, I have to explain that on my license every time I renew it, on my NP license every time I renew it. It's just on file with the South Dakota Board of Nursing. So I did struggle with some of that for a while. That's why I say we all have opportunities to tempt fate or go down that road. And based on your own resiliency and your choice to decide how you want your future to go, I've had several people tell me in my family, because of my mom's alcoholism, if you end up this way or if you end up that way, we wouldn't be surprised because your mom is this way. My mom is somewhat of the black sheep of her 5 siblings. So it was always expected that her children would end up the same way. I did not.
Right. And that's where there's this difficult pendulum
Mm-hmm.
of being stern and also compassionate,
Mhm.
right? We could easily make excuses to continue to be drunk. And we, alcoholics and addicts, love that. We love the self-pity. Poor me, I have no choice. This is who I am. I can't help it. I'm a byproduct of my
Oh,
childhood. I'm
yeah.
a byproduct of my whatever situation, circumstance. I can't help it. When that's not true.
Mm.
And so one thing real quick people say is like, it's not a disease. Or is it, right? Like,
Mm.
obviously, alcohol abuse disorder, I think the American Medical Association defined it as a disease in like 1958.
Mhm.
So it's been it's been a while. I think addiction, I think, was like 85 or whatever, but
Mhm.
alcohol abuse since like the 50s, considered a disease. What's your position? My thought was, well, we like to define it as a disease because it helps us to have more compassion.
Potentially. I mean, when you think about the description or definition of disease, what do you think the definition is? What does disease mean to you? So if you were
Yeah,
to define it, how would you define it?
right. A medical condition that you can't help
There
having,
you
right?
go. That's where we get into the adage and the verbiage of you can't help it, right? It's
That's
the
right.
first place people go. If you think about disease as a disease state itself, it is a debilitating thing, right? It is the abnormal coming in and upsetting the normal in your body. So when we think about disease has that negative connotation because it overtakes, it overpowers, it impacts what should be your normal function. So what's the pull? What's the draw? The draw is to help those individuals right the system, fix and get that homeostasis, get that sense of normalcy and balance back that you're used to as a functioning individual. So are you going to show more compassion towards basically crusading for an individual and, floating for the cause, trying to get them back their sense of normalcy? You are. So it's a disease, it's a state of mind, it's a state of system. If you have the ability to look at it as purely that, you're only treating one facet or one state or one system. And it's hard because there's a lot of stigmatization that comes with mental health. Mental health has long been fraught with negative, right? We can trace roots and origins for bipolar disorder associated with a lot of these conditions to Roman times over 3,000 years ago. But there was a lot of time where people were like, yep, nope, it's not genetic. It's conditional. It's environmental. No, bipolar is genetic. There are components to that. And some of your impulse drive and reactivity from bipolar disorder also ties into the alcohol use disorder. Antisocial personality disorder, also known as sociopathic disorders, also tie into alcohol
Yeah.
use disorder because of symptomology, right? But that's where we go back to people are multifaceted. It's never just one thing. There's not a conditional cause. The system is out of whack. That's why you have to figure out, well, what cog or what wheel is out of whack? That could be many. That could be one. So if you look at disease state as again, as a state of mind or a state of situation, it's easy to be compassionate because you're going to fix it. You're going to right the wrong. If you look at a disease as something to be mired or negative, a disease is like, okay, this is something nobody wants, nothing wants, like the leper of the situation. We just want it to go away. You just don't want to be associated with it, which is something we see with alcohol use disorder too, right? Is that people just don't want to deal with it. They just don't want to act like it exists. They just want it to go away or pretend it's not a problem. If you're looking at disease in that form or that state of mind, then yeah, you're looking at the pity train or, the non-empathetic approach, the approach of judgment. So I know it's very important for me as a clinician to know that if you look at it as a state of mind or a state of situation, deserving no matter who the individual is, of support and being offered those resources. I mean, that's imperative. But I'm also somebody who believes too, you need to be accountable to your mental health. You have to be accountable to this process. I'm going to work with you and partner with you. But if you're not able to take part in your care, don't waste your time or my time.
Right. And if you're not honest,
Yeah.
I probably lied to you a lot, right? Would you say?
You had a few times.
Probably was
Yeah,
not
definitely
honest.
some cyclic. I remember the time too, you guys went to Florida and you came back and we were talking about the pot,
Yeah. Oh, yeah. Marijuana
the
use.
marijuana use, and you were hiding it in the bathroom at the hotel. You were trying to do it in between. You're like, I was just so irritable and frustrated. And I just wanted to get back to the hotel. and then you were trying to utilize resources there. And then when you got back, you and your wife, Britt, had gotten into it because you tried to vape in the bed. And I was like, it knows no bounds. You're like, I don't see what the problem is. And I'm like, really? Like, you're vaping in your bedroom next to your
like
spouse.
nicotine vaping.
Yeah, nicotine vaping.
Yeah.
So, I mean, even the most anomalous things up to the big egregious things, it was like you said, if I could find a reason to do it or if I could find opportunity, I would.
Mm-hmm.
And you're like, I can't do this anymore. I can't rationalize, like, this is ridiculous. I have to go to a bathroom. I have to go to my garage. I have to time it so people aren't around when I use it so they don't know. Like, it becomes extremely energy probative to keep it up.
So you're just getting high.
Yeah.
Right?
I mean, it's just, that's the goal.
Yeah, it is exhausting, but it's all I knew, obviously,
100%.
right? And wasn't hopeful that anything else worked. I knew other things worked, just not fast enough.
Right, exactly. And that's that dopamine chase or that adrenaline piece of things, instant gratification that comes with the impulse of alcohol use, especially, or any drug, truly.
Right. I know if I took a hit, it's instant. Chug a bottle, it's instant. Took a pill, it's pretty quick. Valium, pretty quick. That feeling of, oh yeah, I'm feeling it now. It's kicking in. And that's the hard thing about sobriety is life doesn't work like that. Spirituality doesn't work like that. That was my struggle with God is I was trying to pray. It wasn't working. Well, it was working, just not in the first 5 minutes. And that's about all the attention I had before I gave up on it, you know, and you just got to get out of that mindset of long-term benefits. All things that are good take a while, right?
Absolutely.
The best meals take time to cook. And so
it has to be tangible.
Yeah.
It has to be realistic when you're goal setting. You can't expect instantaneous results. Like I tell patients, it took time to put on your history. It's going to take time to heal it.
But it's worth it. And one final thing, marijuana, THC, not so much a dopamine release with that either, right?
It depends. It depends on the strain. It depends on, you know, what type of concentration. A lot of the times, and I'm sure you've heard as well, like if it's laced with something, if it's not in a reputable source. But THC itself, the tetra molecule, it in and of itself in pure form,
not so much.
Not so much.
Because that's why people say, oh, it's non-habit forming, right? It's non-addictive because it doesn't react, you know, your brain doesn't react the same way, which I disagree with.
Oh, it does. It absolutely does. And it also depends on clinical condition. A big thing I educate on, I am somebody who prescribes medical marijuana cards in the state of South Dakota. So I'm an authorized provider for that too. And what I tell people, especially when it comes to education with medical cannabis or cannabis, it's cannabis, you're using it for medical reasons, is that different strains will produce or incite different results. So if you're somebody who is an attention and focus individual, for example, you need that dopamine. You need that to come to the front of your brain or the frontal or prefrontal cortex for executive function, right? Getting dressed, paying your bills, going through the day, eating, engaging with others. There are certain strains of marijuana with attention and focus disorders that will actually incite more anxiety or more of a loss of a feeling of control. Some of the research I found out there is that you'll hear the strain indica is typically responsible, as they say, couch, right? It's a relaxing agent. It's used to calm the system down. We have found that in individuals who have attention and focus issues, that sense of calm and serene actually takes away their promotion of control. And so you're actually inciting anxiety and inciting unrest because you're messing with that equilibrium as they know it. Whereas sativa, a lot of the times people will say is more, more of an elevator, more of a booster, right? But for an ADHD person,
no,
that's like pouring a match or lighting a match on gasoline.
That's right.
It's horrible for the body. So you'll see more productivity in some with ADHD with indica because it's calming, clear, informative. Now, at the same time, and I referenced an article by Susan Stoner, archaically, in fact, that was published originally in 2015. You have to be very careful about, there's endocannabinoids, which are your plumpers to THC or the tetracannabinol oil, right? And based on how genetic morphology is, could be impactful. Some people have genetic polymorphisms or they have genetic defects within their strands that, yeah, I'd smoke some weed. It's not a big deal. But if you have morphology issues, which you can't see readily, people will struggle with being collected and controlled. They will feel way more than the average person, or maybe way less and have to consume more based on that polymorphism. And if they don't respond well to E1 and E2, which are your endocannabinoids, then absorbing THC could be problematic. I mean, these individuals could carry a high a lot longer than others, or they could zip through it so fast that the demand for more and more occurs. So that's why I tell people, when you say it's non-habit forming, it depends on how you absorb it.
Of course, yeah. And that was kind of what I was trying to get to, was this same thing with ketamine. I like ketamine. They say the same thing. Actually, when Matthew Perry died, that's how he drowned, was using ketamine, right? And his mom in an interview said he was really excited about it because it's non-addictive. That was his pitch.
Very much incorrect. So they akin it to LSD as an impact. It's more the function of ketamine, not the drug itself. So when you think about that, it works on NMDA.
To be clear, like LSD or ketamine or those
they're
things,
highly addictive.
They are, but they're not like when people say that they're saying it's not like nicotine addictive.
No.
It's not like you're going to have withdrawals from ketamine or LSD.
It depends on how it's administered again. But with ketamine works with NMDA receptors, right?
Yeah.
Your dissociative receptors of the brain. The act itself is what people crave, because you're basically shutting down a part of the brain, putting up a construction zone, repairing it, opening it back up, moving on to the next area. Okay, so that's what ideally ketamine does to the brain. And we talked about neuroplasticity, right? It's restorative in a sense, because it'll shut down an area for basically restructure and construction, open it back up. So you're getting some of those formative parts of your brain back. The problem is that, again, if your brain is not realistically set to have 45% more functionality outside of ketamine, when you come back down from ketamine, the response could be quite variable. You're not used to having, this euphoric plight of things. And I've administered Spravato, the S-ketamine isomer, which is the nasal spray, right?
Actually, I did Spravato, and that stuff works really
well. It does.
You don't get a high.
100%.
Yeah, but I could definitely, it helped a lot with my depression.
You will see, though, some people it doesn't. I've watched people go through seeing pink clouds and being highly depressed and crying all over the place, to feeling numb and heavy and everything is electric, to wanting to bolt, like they're going to crawl out of their skin. They can't sit still. So I've seen it affect people differently with the outcome of treating your depression. But we also have a policy in place a lot of the times as providers that after a ketamine derivative or ketamine is administered, that you're on watch for 24 to 48 hours after. We call and we check in. We make sure that you're doing well post-procedure, because it has the ability to absolutely tank you and cause a refractory effect. Remember, anything you put in your system that's not naturally supposed to be there can have that profound effect, but can have the boomerang effect as well.
Yeah, and it can be dangerous. And I guess all that to say is, and you said it, dissociative effect.
It does.
And so ketamine, LSD, those types of mushrooms.
Microdosing of shrooms has become a really big thing.
And so they don't necessarily have the addictive traits, but somebody like me could easily become addictive. Same with marijuana. I was addicted to marijuana because, it would help me disassociate, or it helped me to numb until it didn't.
Yeah.
Right.
And that's that again, that disappointing birthday party over time, but it's the function of the drug, what it does. And that's why when we talk about epigenetics, some people have an affinity towards more drugs than others. You can have somebody who snorts a line of cocaine and it does absolutely nothing. You could have somebody else who comes up and is like, all right, let's hit the party town for as long as we can. And then they're bereft and bankrupt because they've got to keep chasing that high. And then you've got some people who have a predisposition to alcohol, where there's some people who can have a couple of drinks and put it down and don't even have a second thought. So there's a lot of research movement towards that epigenetics and what do we have more of a propensity to. And that also has to deal with those transmitters we've talked about, the glutamate, the gas pedal, the GABA, the brake pedal, norepinephrine. Epinephrine's another one we talk about, which is like your impulse reactivity, do things first, ask questions later. Serotonin, your regulator, and dopamine, the natural high you create. We have a lot of emphasis lately too on histamine, kind of the lost transmitter. Histamine is an excellent conduit for many of those transmitters. So if any of those stand up and are the lead actor in your show, then you're going to gravitate towards drugs or interventions or influencers that meet that demand of that starring neurotransmitter, whatever you need to fulfill or fill your cup with.
100%. And there's not a one shoe fits all.
Correct.
And just because you don't have an issue with alcohol or marijuana and you've never had a problem stopping at one, understanding that the brain is a powerful thing and nobody's brain's the same.
No.
But ironically, I could go into a room full of alcoholics and we can all connect on a level that is like nothing else. And that's the beautiful part of it. And really a big part of it is because it's not so much the substances we use. One of my best friends is a former meth addict. My sponsors is a former meth addict. They never really had too big of an issue with alcohol or marijuana or these things. But, and when I talk about benzos, love benzos, other people will be like, oh, I never really liked that. Or I never really liked opioids. I don't like how they made me feel.
Yeah.
But in reality, it's like, it doesn't matter. We just find our one thing where it's like, this is how I want to feel all the time. And then we're willing to give up anything and everything to feel like that all the time. We'd love to be normal, but it's much better, or not better, but it's easier to be comfortable. And that's what we don't like, to be feel uncomfortable. Well, shoot, Dr. Koupal, I sure appreciate you. I think if I were to sum it all up, because that was a lot of info, but honesty is just the key.
Exactly.
I wasn't honest with you. I wasn't honest with my wife. I wasn't honest with Tracy, who is also a guest. She was our therapist. I wasn't honest. I think I had to make an amends to you and Tracy because I wasted so much. I felt like I wasted a lot of your time sitting in there. I don't know what's wrong. I'm still depressed. Your meds aren't working. My wife says, I need to try different meds because I'm still struggling through. I wasn't telling you that I was abusing anything and everything I get my hands on.
So I knew, though.
Sure, but you can't say that.
Oh, absolutely.
Right?
Cannot
because
assume.
then that would be the last time I saw you.
We just played to your strengths.
Yeah,
so when you were talking about the political drive, every time we would have the bigger politically based conversations was done on purpose.
Oh, sure, yeah.
So meaning that we could draw you to something that would give you passion and fire, that would elicit a dopaminergic response that didn't contain a drug.
Right, sure, yeah.
So I played to your environment at that time to elicit that happy response because you would light up. It was vibrant. Like you would get going because you were so passionate about your cause.
Social issues, right?
Exactly.
Yeah.
And so that elicited its own dopamine response and you didn't need a drug to do it.
Right, yeah. And that's it. And it's learning how to find what you're passionate about in a healthy way as opposed to critical and being judgmental.
You're right. If I'd have called you out directly and would have said, hey, Seth, you have a problem. It's not the meds. It's you. It's this.
Yeah.
Had been more of a, nuance to you or a nag to you in this situation. Yeah. But if you pay attention, obviously learning about people and seeing what elicits that fire, that happiness, that spark. So I just deviated towards political entendre because we had very similar beliefs. And so I was like, well, I know how I can get him to, hey, did you hear about this? And you were, boom, off to the races. You were like, oh my gosh, you hear this, 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 and this.
Yeah.
And by the end of it, it was like almost like an aerobic event because you were so excited about talking about all this knowledge and all the things you knew and how these people were wrong and you were right.
Right,
how,
that's an ego thing too, right? You're kind of feeding my ego in a way where it's like,
let's show your brain.
I like hanging out with Dr. Koupal because she makes me feel smart. In reality, it's because had you called me out and said, actually, Seth, I don't think you're being honest with me. I don't think you're being honest with your wife. I think you're hiding things, wasting my time. That would have, one, deflated my ego. And I would have said, well, Dr. Koupal's no use to me anymore. And she sees me. That would have been my biggest, right?
You don't want that. You want to downplay the use, downplay the
me.
problem. And the other thing is, too, is you eventually got to that point. That's what I tell people. It's that epiphany. It's realization that there's something else out there. So then we could have the conversation, hey, man, like, you need to talk to Tracy. You need to talk to your wife. You guys really need to talk, and you need to let them know what's going on. I could have that conversation with you when I knew that you were starting to see the other side, when there was hope for other situations outside of downplaying. It's not that big of a deal. I'm not doing that. Or, hey, it's okay because I'm doing this, but not this, right?
Yeah.
And so that's got to be better than the thing I was doing before, right? And so-and-so doesn't know about it, so it's not really a big deal. Once you got past that rationalization and kind of the excuse stage, I noticed your conversation about politics also started to come back down. Your objectivity increased, and you were able to be perceptive of the other side. And that was when you started talking about prayer and spirituality.
Right. Yeah. You'd be willing to acknowledge people outside of what box they fit in, right?
Which is exactly where you didn't want to be.
Right. Yeah. And I always thought of myself as a pretty open-minded individual, but in reality, I was very narrow-minded and prejudicial. And a lot of the things that I would get upset at other people about, I was very guilty of the same thing, right?
Conformist for the cause.
Yeah. And thought, oh, I'm not like them. But in reality, I was worse. And once you come to accept that and you start being so inflated, I thought I was the most humble person, right? And in reality, it's not so much of thinking less of yourself, but thinking of yourself less, right? That's humility. And that's what I found, because I was like, I'm always thinking of other people. That's not humility. Humility is stop being focused on Seth all the time. And once you get that point, then life's beautiful and a lot more enjoyable and fruitful and beneficial. And yeah, so dang, you're awesome. I appreciate you. Thanks again.
You. Appreciate you as well. Thank you very much.
Keep up the great work.
Oh, thank you.
Happy birthday.
Oh, thank you.